All right. I feel like fam. Good morning. We are here with Josh Porter from Optimize You. He is the owner and operator of Optimize You. And today's topic of conversation is it safe to take Ozempic, TRT, and other synthetic hormone boosters? Josh, tell us a little bit about yourself and why you're the guy with the plan.
Yeah. Well, thanks for the introduction. I don't know that I'm the guy with the plan. I just happen to be on the other side of the microphone today. But I'm a physician assistant by trade. I went to PA school 2009 and started practicing medicine in 2011. And for most of my career, just practiced in corporate healthcare, emergency medicine, surgical fields, things like that. And then about 4 years ago, really just became somewhat disenchanted with the way traditional medicine, modern medicine, Western medicine was going when
Hmm.
it came to how do we manage disease, how do we prevent disease, which is just not even something that's on their radar. And so, I thought, man, I'm no spring chicken, but I also have plenty of years left in my career,
Hmm.
and I really wanted to see if I could do something different and step into a space where perhaps before somebody developed diabetes and hypertension and dyslipidemia, insulin resistance, obesity, that maybe there would be a place where we could start having conversations with aging people to say, hey, maybe there's a different way, right? Maybe there's a different
Yeah.
way to think about health and exercise and sleep and nutrition and hormone therapy and weight loss medications. And so we did that. So in January 2022, I opened up my first location, and it's been a blast ever since.
Now, Josh has helped me with my hormone issues, and I didn't even know I had hormone issues. I had no idea, and I was like, maybe I should go get checked out. And then it turns out myself, and then a lot of guys my age have low testosterone. And then I took my wife in there, found out that she has PCOS, and then I started sending all of my clients to Josh. And it turns out that at least 80% of the women that train with me have PCOS or some form of hormone issue like that. And Josh has been able to help them work on leveling out their hormones. Now, one reason I wanted to hop on a phone call with you today is because I argue with people on TikTok a lot and Instagram about hormones and how to lose weight. And the problem with the fitness industry today is like everyone is an expert, but also a lot of 99% of people are underqualified to talk about these issues. So one topic I was having an argument with someone was the fact of weight loss and PCOS and having hormones out of balance in general. And this guy said that it doesn't matter what issue you have, as long as you're in a calorie deficit, you will lose weight regardless. And that peeves me off because I'm like, you bro, like you're that person is only frustrating a person that does have hormone issues. I've been a personal trainer for 10 years and I've seen hundreds and hundreds of women come in and not lose a single pound. They tone up, they're in a calorie deficit, they're hardly eating anything, and they're not losing weight. And I want to get out there and say that it's not because of them, it's because something inside them is not working properly. You can be in a calorie deficit and not lose weight. So I wanted to bring you in on that conversation of your typical bro science, your bodybuilding trainer that will come out and say, well, if you're in a calorie deficit, you'll lose weight. What's your perspective on that when
Mhm.
it comes to having PCOS or a hormone issue? Can you lose weight properly just by being in a calorie deficit with a hormone issue?
Yeah, it's a great question, and I think the whole bro science world. One of the things that we lack greatly in the world of social media is we have this. We want to be controversial. We want to say these zingers, right? We want to get views. We want to get likes, and so you get a lot of people's opinions out there. To your point, where it's like, man, there's really no validity to that. And so, I think when one of the things that I've always wanted to approach my patients with is empathy, right? I don't know what it's like to walk in the shoes of a patient with PCOS, but here's what I can tell you because I've done this long enough. There are very few females in particular who have PCOS who have not tried caloric deficit, who have not tried exercising 5 or 6 days a week, who have not tried to get rid of all carbohydrates, and yet they still are struck. They're stuck, right? And it's not just body composition. I mean, you also then take you can go to the extremes of one of the down, spiraling consequences of PCOS is infertility, right?
Hmm.
And so you've got these women who are just broken at the core of like they their cycles are irregular, they're overweight, maybe they've got androgenic side effects from the testosterone imbalances within PCOS, and and then the icing on the cake is they're infertile and they really struggle, and so. So yeah, I would adamantly oppose the position that a PCOS patient through caloric deficit should be able to just kind of, man up, so to speak, and figure this out, because there's so much more complication. I mean, what I always tell people about PCOS. So PCOS is polycystic ovarian syndrome, and what that basically means is when they found the diagnosis, there's by diagnosis you have to have a string of pearls, right, in the ultrasound looking at the ovary. So there's multiple little cysts or multiple little in the ovary. There's these little string of pearls that look in there. Well, the reality is that's a gynecological consequence, but it's really an endocrinology issue, right? More than 50% of PCOS is actually because of some endocrine issue, such as insulin resistance. And then you have the gynecological consequences of infertility or irregular periods, or you have dermatological consequences of hirsutism, male pattern baldness. So there's metabolic consequences of obesity. So all these things, but it really goes back to oftentimes insulin resistance as the key like trigger for that diagnosis of PCOS.
Now, a lot of the times when I have a new client come in, I introduce them to you, regardless if they're in Oregon, Hawaii, or whatever. I make that
Right.
connection so they can work with you on regulating their hormones. Now, one thing that I'm seeing in the industry is a lot of misuse of these. I guess I'm going to call it a medicine or a drug. I'm going to say drug. A lot of misuse of this drug with, in all honesty, I'm seeing a lot of fitness influencers partnering with supplement companies selling this stuff over the counter or online, just like nothing.
Yeah.
And I'm having a lot of women coming to me that have not tried any kind of weight loss program or nutrition program or supplement program, go straight to Ozempic or whatever it is that whoever is prescribing them. And even if they don't need it, if they don't have a hormone issue, they're taking it.
Yeah.
What are the side effects of someone who does not need it taking it?
Yeah, well, I think the side effect profile is the same regardless if you need it or don't need it, right? But I think the problem at hand is, um, number one, there's financial gain for clinics, providers, social media influencers, right? So you can make money off of putting people on Ozempic and Monjero. So you've always got to kind of walk through that. Like, does this person have my best interest at hand, right? Because otherwise, it's just, hey, everybody gets Ozempic, right? You're just shelling it out. Um, the but the issue for me is it goes back to what I would talk about with pillars of health, right? I mean, I get patients in my office all the time who say, "Oh, Josh, I'm here because I want to do one of the GLPs," and then you really start to dig in, Gage, and what you realize is like their diet's terrible. They don't exercise. They call walking with their spouse exercise, and I tell them that's a hobby. It's cute, but that does not count. Um, their hormones are crashing, right? Maybe they're perimenopausal, so they've got all these other issues. They sleep terrible. So they've got all these problems, and then they want hey, just make me eat less. And the biggest concern I have in that approach is, well, what are you going to do when you don't take it, right? It's just like any other medication. I mean, let's use a blood pressure medication. If a blood pressure medication works and lowers your blood sugar, or blood pressure, what do you think is going to happen when you stop taking the blood pressure medication? Not going to work. So we shouldn't be surprised that when somebody takes Ozempic, gets results, stops Ozempic, and doesn't change the lifestyle, right, that is needed to incorporate those. Well, what do you think is going to happen? They're going to regain the weight. And then secondly, it's kind of fallen away a little bit, but you've got the Ozempic face, the Ozempic butt, the saggy skin, loss of muscle. And I think, again, my argument would be I almost think that's really probably more negative towards Ozempic than it should be, because I think that's really not a knock against the medication as much as it is against the way they're being treated, right? So if you microdose those things, you're going to get a very different approach versus if you just say, hey, don't change your diet, but now when you go through the drive-through and you get a Big Mac, well, guess what? You're just going to eat half of it because I'm going to give you this huge dose
Yeah.
of Ozempic, and so your appetite's going to be suppressed. So it's going to work until it doesn't, until you come off of it. And so I think that's probably my biggest hangup is we are missing that key component of education on the front end, and we're
Yep.
just so quick because it's a moneymaker. So we're so quick to give it because the reality is too, if I don't prescribe it, right? Here's the narrative, right? In a business, if I don't prescribe it, they're going to go find it somewhere else. So I'm just
Yep.
losing out, right? And so you have to be. I mean, I can't tell you how many times I've told patients, listen, I'm not doing it. No, I'm not saying never. I'm just saying it's not right now because
Yep.
it is not. I am not serving you well by by enabling you to not make any lifestyle behavior changes
Yep.
and just give you a medication. So I think that's the biggest slippery slope, in my opinion, is that we're let it's a wild west of just throwing those things out there, putting everybody on it, and with very little management.
I've spoken to many people who are overweight and they don't have any hormonal issues, and their doctor, they're actively trying to get them to get on Ozempic, regardless of the situation. So what I like to do with clients is I bring them in, and my whole thing is whole body wellness. Let's take a holistic approach to this. Let's try to get a supplement stack there for you and see if that helps. Let's focus on making, like you said, the lifestyle changes. Let's find a workout routine that works for your body. Let's find a nutrition routine that works for your body. And most of the time, that nutrition routine, regardless if you have PCOS or not, for most people would be a lower carb diet. Now, if
Sure.
I can take an individual and put you on that diet and you do it for 3 or 4 weeks and you start to see some results, that's great. But the problem is that you can do that diet for 3 or 4 weeks, but what happens after the 3 or 4 weeks after that? You start to fall off and then you get frustrated and then you're like, oh, I need to take Ozempic. One successful thing I've done with one client is they got on Ozempic and they lost 50 pounds, or they got it on, or semaglutide with you. After that, I call it a trial run. After that trial run, we took them off of the semaglutide and focused on maintenance for the next year. Right. So lost 50 pounds. We were able to maintain with good nutritional habits. And then after the good nutritional habits, they had a wedding coming up. So I said, well, maybe we can go back on semaglutide for the next 6 to 9 months, focus on trying to lose a few more inches, because during that time of maintenance, we were still actively trying to lose body fat and weight.
Okay.
It
Yeah.
just was not happening. We were toning up tremendously, but the body fat was not coming off no matter how low on the carbs we went. So I have some people that just they can't lose. So we put her back on the semaglutide, and now the inches are coming off like crazy. Um, so you have some women that can take semaglutide, lose all the weight, keep it off. You have some women that can't lose weight in general, unless if they're on it. So my approach to this is let's cycle on and let's cycle off and see how your body adjusts versus what most people do. And I've had clients before in the past that don't train with me anymore that have absolutely horrific diets that eat Oreos for breakfast. I mean, I'm just calling it like it is.
It
And
is.
they're taking this and losing 60, 70 pounds, continuing to live that lifestyle. They're getting frail, they're losing muscle mass, they're losing bone density. Um, and then they just take it for the rest of their life. What is your opinion on the people that are relying on it to take for life? Because I mean,
Yeah.
this is the vibe that I'm getting from some of the people in the industry.
Uh-huh. Yeah, I think there's well, again, I'm always hesitant to speak in absolutes, right? Do I think there's probably cases, perhaps? I think it should be sparse, and I think we should always uh, have a goal of not being something that's somewhat dependent. So that would be one. And I think to answer your question real quick about your idea of like cycling on and off, right? Maybe cycling is not the right word in medicine. I don't know, but you
Yeah.
understand what I'm saying. Uh, well, there's actually data, just so you know, you're not crazy as so I'm just going to kind of affirm you in that because receptor site sensitivity actually increases when you take breaks. And so when you have to have these people where there's high doses, I do this all the time where I say, listen, we're going to take a break because it's not working and we're at a higher dose than I want you to be. And I mean, it almost never fails if you give them 4 or 6 weeks, sometimes 3 months, let them take a break, they can start back at a really low dose and start seeing benefit. Um, so, are there people who could benefit long term from GLPs? I think the data is still out on that. I mean, and I say that because we are seeing that GLPs, the hormone actually works, is produced in the gut, but it has effects in the brain. It has effects in the cardiovascular system. So there's studies showing that it decreases joint pain. So it'll be interesting to see the longer these medications are out. If we can find that, hey, and just so people know, like, why would that happen? I think majority of the reason those things happen is because one of the things that GLPs are pretty effective at is lowering inflammation, right? Well, dementia, as an example, is an inflammatory issue. And so if I'm controlling inflammation through the use of a GLP, is there potential benefits for reducing the risk of Alzheimer's? Maybe, when some data is out there that seems kind of favorable. So I'm not opposed to the idea of it. I think you just have to continually go back to ask the question of why is that patient wanting to stay on Ozempic? Is it a security blanket? One of the things I do when I'm trying to wean them off sometimes, if let's say somebody reaches a goal, and so they're not struggling, they're not plateauing. It's like, hey, I've lost 40 pounds, I feel good, I'm taking 1 milligram of semaglutide, I want to start weaning down. I don't usually let them just stop that cold turkey, because there's as much here as there is anything, where
Mhm.
if I pull that from them, they're going to freak out. So I usually start to kind of a taper down effect, and then as I get to a really really low dose, doing that weekly, I actually start to extend it and let them go, hey, instead of doing it weekly, why don't you do it every 10 days? Now do it every 14 days. Now do it
Yep.
every 21 days. So you start this process where you're equipping that body to start responding favorably to the change. And then, sure enough, again, unless they fall off the wagon, they don't generally see a ton of regain of weight, right? And so it's one of those things. It's just how you approach that patient that matters.
So one thing you talked about is gut health, and one thing that I've discovered with my journey and a couple other people's journeys is that uh, a lot of people, especially in the I guess my generation, a little bit younger, from like 20s to like maybe 40, typically have horrible gut health. If you go in, you get a job map test, you come to find out that it's completely whacked out. And I take that in terms of, like, you've been taking way too many antibiotics in your life. If you're constantly taking antibiotics every time this sick season comes around, you're destroying your gut, which, if your gut is not healthy, it's going to be harder to lose weight too. So what you're saying is that GLP-1 is it helping restore your gut health, or is it just taking over for what your gut's not able to do?
Well, specifically in the gut with GLP, really for the purpose of weight loss, it's probably minimal on the absorption aspect, and it's probably more about the motility. So how fast something is digested in your GI tract. That's probably where the GLP is making its mark. So it's not really, you couldn't say, well, use GLP instead of a prebiotic or probiotic, right? It's not going to have the same effect. So it just it's where it has its effect and how it works, right? So I mean, it's got an effect in the brain, it has an effect in the pancreas, it has an effect in the gut. So I don't know that I would say GLPs enhance absorption of other things that you're taking. I don't know that I've seen much data to support that. um, I would say that we definitely know it slows the motility, which is why people feel fuller, more satiated, as a result of what that GLP does in the gut and in the brain.
Okay. My last question for you today is in terms of TRT and semaglutide and all of the studies that are coming out in terms of health. And it seems like to me that the younger you are, the worse your hormones are compared to, like, let's just say, typically from what I see from my clientele is guys that are like 36 years old and older typically have a normal range of testosterone. Guys below that age range typically have, you probably see something different, but typically are on the lower end of the testosterone. In terms of like women being diagnosed with PCOS and guys being diagnosed with low testosterone, why do you think that is such a huge problem in the younger generation, or are you seeing something different?
No, I definitely see it, and I think you see it. There's actually a book called Countdown that talks about the declining, rates of masculinity issues. So, sperm counts and testosterone levels, and we've been seeing this actually since the 1950s, but probably more prevalent over the past 20, 30 years. Just where some studies have shown a 20% decline in testosterone levels from one generation to the next, and so I think you've got. I think the last time I saw this number, I want to say it was 85,000, man-made chemicals, right? So we're constantly, with shampoo that we're putting on our hair and lotions and makeup, or for women, and deodorant, the foods that we eat, the waters that we drink. I mean, it's almost. I mean, you and I. I mean, we could almost share your story, right? You went through
Yeah.
a journey where you're like, hey, I'm gonna get all the plastics out. I'm gonna get all these things out. It didn't really help, but but that's the problem, is that it's even when somebody takes an extreme measure and says, I'm getting rid of all microplastics, but are you? Right?
Yep.
Like with everything, I mean, the smog and everything we inhale, I mean, there's so many things. There's so many, we call it endocrine disrupting chemicals, that affect that. And then there's medications, in the United States. I mean, we're quick to throw antidepressants. Well, SSRIs can lower your testosterone levels in men. I think, um, in how we treat young men, we you know the feminist movement. Listen, I've got daughters. I'm married. I love women, but I think it's actually been a detriment to men, because it has men have kind of cowered down, and I think we are
Mm.
meant to be aggressive. I think we're meant to be
Yeah.
physical. You put a young man in school and tell him to sit still for 8 hours. I just think our society has lessened what it means to actually be masculine, and I think that you're just like evolution, right? I mean, I believe in creation, but there are things that happen where, as time goes on, we become more resilient, and things change within the culture, and I think that happens, right? When you're not looking for your next meal, and you're not having to go out and work for it.
Yep.
Does my testosterone level really need to be 900? Would be how
Yep.
our body kind of starts to work. And so I think there's just so many factors, that are at play as to what impedes that. But dude, I mean, it's not even a controversial thing. It is a legit problem that is well documented, and there's really no debate about it.
I will say this in terms of my own journey. When I came to you and I discovered that, so typically around guys my age, according to you, I should be sitting at least like 6 to 800 in terms of
Yeah,
testosterone. I was sitting in the low 300s, and I was exercising. I've been exercising daily. I eat healthy and all that, and all the things that you think of. You would look at me and be like, he has high testosterone. I didn't. And when I came to you, we talked about that. And my main thing was, let's find a natural way to boost this
yeah,
testosterone. We went through the supplement route, and then we ended up doing HCH or ACG,
HCG.
and then ACG, and then clemifene. Is that right?
Yep, yep,
And I've been talking to a lot of guys about that specifically because we were able to take my testosterone from the low 300s to 1,000. And then we talked about cycling off and finding a new level for me. And after I cycled off and figured out what that was, we were able to get me to around the 600s
yeah,
just naturally.
yeah.
Um, a lot of guys go straight to the TRT route, which completely shuts off your own natural supply, and then you're on that. Typically, you'll be on that for the rest of your life. Am I wrong on that, or is like how does that work?
Yeah, so fertility is probably the thing that I'm most worried about in my patients, right? As far as men, and I mean, it's essentially what we refer to as azospermia. So if a guy is on testosterone, your sperm count is pretty close to nil, right? Now, are there exceptions? Sure. You'll always hear, well, I got my wife pregnant, right?
Yep.
And they were on 600 milligrams of testosterone as a bodybuilder or something crazy. But in general, yes, the idea is once you start testosterone, you will achieve azospermia probably within 6 months, and then even if somebody comes off of testosterone, uh, their levels will return. They'll bounce back, probably not to where you were at baseline on your testosterone, but your sperm counts won't either. So, probably at best, I'd say most of the data would suggest that if somebody's on testosterone for, let's say, a year or 6 months or something like that, and they stop it, I would caution them and say, listen, your sperm count may return, it just won't return back to what it was. So you may be at 50%, the volume, and that's why I choose in my younger patients things like HCG, clomiphene, because I'm using those medications to make that individual's testicles produce the testosterone, and that's just a safer way to go about it for that preservation of fertility.
So would HCG and clomiphene work for someone in their 40s?
Sometimes, but the true rate limiting factors is the patient's testicular response, right? Because what I'm trying to do in the use of HCG and clomiphene is I'm trying to use your HPG axis, your hypothalamus pituitary gonads, to produce that testosterone. And sometimes, right, I can give somebody a ton of HCG or a ton of clomiphene, and their testicle just can't keep up with it, right? So they've got this high stimulation, but they can't. It's almost like menopause, to some degree, a little different, but like at some point the ovary just stops working, right? Well, for men, we don't just stop, our testicle doesn't just stop producing, but it just can't keep up. It's like we call it primary hypogonadism, where the testicle just is like, you can try to get me to do it, but I'm not doing it.
Awesome. I love, we'll finish off this podcast with testicles. Uh,
That's right.
Josh, for anybody out there watching, if you have any questions or comments for Josh, please put them in the comment section. Josh, if someone were anywhere in the world, how can they reach out to you to get help?
Yeah, I think the easiest thing is just to try to find us on social media. One of my passions, Gage, is and I tell people this all the time, is to educate and empower, right? I mean, if I can give some people some free advice, and, you can watch our videos, we've got podcasts. So, Instagram, Facebook, you Chattanooga, Optimize You Chat, you can type in either one of those and you'll probably be able to pull us up. My podcast is Optimized Health. And so, just finding resources like that where you're because you can always send us direct messages, but I think that would be a place where anyone in the world could go there, get some really good insight and some ideas, and maybe just some questions that they should be asking their provider.
And that's one thing I want to end on is that it's hard to find companies and people to actually trust in today's society because
Mm,
everyone's trying to sell you something. And one thing that I really like about you, Josh, is that you're willing to take the natural route. You're willing to say, hey, go to this supplement store over here, try this first. And if it doesn't work, then we can help you. It's not about like, hey, let's put you on this, let's put you on this. And I can't stand that with doctors. They are just willing to throw you on something and keep you on that thing for the rest of your life. So I really appreciate that more of a holistic aspect by you, Josh. But thank you so much for being on today, answering my questions and helping out whoever's watching this. Other than that, peace out.
see you guys.